beyond the sea, somewhere waiting for me.
Hello, and welcome. This is an educational video for nursing students on reducing the risk of falls in people over the age of 65. Falls are very common amongst people over the age of 65 and can lead to greater lengths of stays in hospital, increased amounts of comorbidities, and increase in the cost of hospital stays. And the patient may even lead to death. In order to prevent falls, we must first understand how a person can come to fall. This was a preventable occurrence. 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 Falling can occur due to a number of different reasons. Environmental factors such as floor surfaces, lighting conditions, and clutter can increase the risk of falls. The most common cause of falls is poor balance. Poor health and nutrition can lead to a balance deficit, as can some side effects of medication. Identification of a patient's risk and environmental factors that may contribute to the patient falling can reduce the incidence of patient harm. Let's examine how we can prevent the falls in people over the age of 65. Ill-fitting shoes can trip and upset the balance of a person. Here we have correctly fitting footwear, ensuring a smooth gait. Here we can see that the walking aid is behind the person over the age of 65.
Hi Betty, you need your walking frame.
Oh, thanks darling.
Having the mobility frame closer and within easy reach ensures that there is no twisting movement and balance is maintained. Having a nurse or family member to supervise and assist with getting up ensures that the person over the age of 65 feels secure and there is less chance of a fall to occur.
Nurse! Nurse!
Hi Maureen. What can I do for you?
I was looking for my glasses, I can't find them.
I'll just clean this clutter up
Can I help?
and then we'll get your glasses. No, you don't need to do that.
Oh, okay.
Removal of objects ensures that there is a clear path and reduces the risk of falling.
And here's your glasses.
Oh, thanks, Mum.
Poor eyesight may lead to falls. Making sure that the patient who needs glasses have them available and cleaned, which decreases the risk of falling. Poor choices in footwear can lead to falls. Socks keep feet warm, but they should be used in conjunction with shoes. Ah, that's better. She's wearing shoes with her socks. Toilet urgency can increase the risk of falls. Continence management can also assist in reducing the risk of falls. Provision of adequate lighting will also assist with the visual negotiation of difficult areas such as the bathroom.
Norma, I'll turn the light on for you.
Oh, thanks, love.
There you go.
Oh, thank you, love.
Pleasure.
Gentle exercise programs are an effective way of falls prevention, improving static balance and dynamic or moving ability. Residents are active participants in their choice of exercise and always retain the right to refuse to participate in any activities they wish.
Norma, would you like to join in and do some Tai Chi or B?
I'm going to take
Are you sure?
I'm right, thank you.
Are you sure?
Yes.
All right. How about do some gardening this afternoon?
All right, that'd be great.
Okay, I'll come and get you next time.
Thank you, lovey.
That's an awesome swing you've got there, Betty. We've got to make sure your brakes are on your chair. How's that?
That was in!
Maureen, your
Yes,
walker's
Mum.
close by for you?
I don't think I need it yet, love.
Okay, so
Just-
it's close by in case you
Yeah,
need
you
it.
better keep it closed.
Okay. Exercises, it's good for your balance, okay? So first we're going to do some knee raises. So you pick up this way.
I
So pick
can't
up
see.
straight.
Thanks, love.
Up and down. Up and down. Up and down. And the other leg.
This is hard work, nurse.
Is it? Keep going.
I've had a hip replacement. Oh, that one doesn't go up.
Try your
Try
best.
this.
You can.
One fit is a fiddle!
And now we're going to do some side leg raises. So out to the side.
I used to do this back in the days when I was dancing.
And the other leg.
Again, that one doesn't go
Well
up.
done, ladies. Just do your best.
Stop wedging, Tiff! Shut up, Beryl.
Your name's Norma.
This book is so good, you girls should read it! It's a blast!
Reading my own book, thanks.
Ugh,
I read that book back in 1927.
God, you're an old bird!
If someone is dehydrated or not eating appropriately, they are at a greater risk of falling. Poor health can lead to poor balance. Even a mild infection can lead to an increase in confusion and also urgency. Good nutrition assists with good health and can reduce the risk in falls. Patients can also be at an increased risk of falls because of the side effects of some medication. It is important to be aware of who is at risk and to assist the person where necessary.
Mrs. Taylor, I've got your medication here.
Okay.
It might make you a bit drowsy though, so go for a lay down after you've taken it.
Okay, so what have we got?
Risperidol.
Okay. Alright, I'll take that.
Okay.
I think she's dead.
You okay there, Norma? Good.
Come and talk to me!
I will in a minute though.
Okay, it's all right.
Okay, let's go.
Wait, I want to go to bed too!
I'll be back in a moment.
I need to go
Okay.
I need a nap.
I don't think you need all those. How about we just quickly?
I don't like her very much.
Me neither. Nurse!
Round this way.
Nurse! Sister!
I'll be back in a minute, girls.
Sister!
I don't like that nurse.
Me neither.
However we try and reduce the risk, falls may still occur. Effective programs involving staff, visitors and residents, as well as other professionals such as GPs, physiotherapists, pharmacists and other quality insurance personnel. Early identification of risks ensure that the best practice is being utilised and that the safety of our patients is at the forefront of our thinking.
Excuse me, lovey. When's
Yes?
tea?
You've already had your tea, darling.
Oh, I don't remember that. When's the next ferry to Sydney?
You're in the Blue Mountains, there is no ferry. Get me out of here, they're not paying me enough.
Oh. He's such a lovely boy. I had him when I was 21. The longest labour ever. Bastard of a father, didn't stick around though. Had to raise him on my own on the farm.
Somewhere beyond the sea, somewhere waiting for me, my lover stands on golden sands and watches the ships that go sailing